Good morning, students. I'm Dr.Anju Balaji More, professor in the Department of Anatomy in Sri Lakshmi Narayan Institute of Medical Sciences under Bharat Institute of Higher Education and Research, Chennai. In today's class, we will discuss about parotid gland. The parotid gland is a paired salivary gland which is located in the region of face known as parotid region. The parotid region is in front of the and behind the auricle. The gland itself is a salivary gland which is bilateral in position. This salivary gland is secreting the secretions which are watery or serous in nature. It is paired with the other salivary glands such as the submandibular gland. The submandibular gland has mixed secretions which are serous and mucus, whereas the third pair of salivary gland is the sublingual gland, which is mostly mucus secreting gland. In addition to these glands, there are minor glands which are present in the oral cavity. The secretions of these glands help to lubricate the food while it is chewed in the mouth. It makes the food into a pulp. It also starts the digestion of the food. In addition to it, when we are not eating the food, the secretions of these salivary glands help to flush the oral cavity and thus maintain the hygiene of the oral cavity. In today's class, we will study about location, external features of the parotid gland, its relation with the surrounding structures, the coverings or the fascia which cover the parotid gland, its internal features or the structures which are within the substance of the parotid gland, as well as the internal architecture of the gland. We'll add the blood supply and the nerve supply of the gland and the lymphatic drainage. We have to discuss the clinical correlation of each structure in anatomy because we just do not limit our discussion to the basic anatomy of the structure, but also correlate this knowledge with the clinical conditions which are related to the particular structure under discussion. The diagram shows the parotid region. It's the region of the lateral surface of the face. The structures, the major structure is the parotid gland, located in front, below and behind the auricle, and the structures in the immediate vicinity of the gland. We can see the parotid duct arising from the anterior border of the parotid gland. We see the branches of the facial nerve, the temporal, zygomatic, buccal, mandibular and the cervical, leaving the parotid gland. We see the branches, the terminal branches of the external carotid artery leaving the gland and the initial part of the superficial temporal vein which enters into the gland. The parotid gland is largest of the three salivary glands which we just enumerated. It is larger than the submandibular and the sublingual pair of salivary glands. The location is subcutaneous, below and in front of the external auditory meatus. Thus, it occupies a deep hollow which is behind the ramus of the mandible. The ramus of the mandible is this upper part which is above the base of the mandible. So this is base of the mandible, whereas this part is ramus of the mandible. and this is the location of the parotid gland in relation to the ramus of mandible. Because of its relation, it is wedge shaped here and it will be viewed externally. When we discuss this structure, we can see it is roughly triangular in shape. Even though it is roughly triangular, the apex is located downwards. So the upper border of the gland will be called as base, whereas the lower end of the gland will be called as apex. The apex of the gland will be located behind the angle of the mandible. So this joining of the base of the mandible with the ramus here is the angle of the mandible. The wedge-shaped gland is seen here in the horizontal section. Now, here what we can see is this is the wall of the pharynx. That means this is medial, this is lateral. Here we see the styloid process. So this is posterior and this is anterior. So with this orientation, this structure here is the cross section or cut section of the parotid gland. We can see here that the parotid gland is related to the carotid sheath and the wall of the pharynx on the deeper surface. Anteriorly, it is related to the ramus of mandible and the muscles which are attached to it. Posteriorly, the styloid process and the muscles and ligaments attached to the styloid process forming the styloid apparatus are related. It is also related posteriorly to the mastoid process of the temporal bone and the muscles attached to it and the nerves and vessels in the immediate vicinity of the mastoid process. Laterally or superficially, it is covered by skin. The substance of the gland shows three surfaces. One is lateral surface, which is nothing but the superficial surface. Because of its wedge shape, there is an anteromedial surface which goes deeper from the superficial. So this is the superficial surface. This is the anteromedial surface, whereas this is the posteromedial surface of the parotid gland. So the arrow shows the lateral surface, the anteromedial surface, and the posteromedial surface. The gland is divided into lobes because of the position of facial nerve within the substance of the gland. We can see the facial nerve running across the substance of the gland. So this part of the gland which is superficial to it will be labeled as the superficial lobe, whereas the part which is lying deep to the facial nerve is the deep lobe of the parotid gland. The gland shows various processes because it grows into the space which is available in its immediate vicinity. The surface of the gland is irregular, and these processes include the glenoid process. The glenoid process is the part of the gland which extend upwards behind the temporomandibular joint. Here we can see it. It lies in front of the external auditory meatus. The facial process extends across the face anterior to the masseter muscle. This is the masseter muscle. The accessory process is a larger lobe part of the gland which is extending anteriorly, and it lies along the course of the parotid duct. Here we can see the parotid duct in the diagram. Next comes the pterygoid process. The pterygoid process extends forward from the deep part and it lies in relation with the medial pterygoid muscle at the ramus of the mandible. Attached to the ramus of the mandible is medial pterygoid on its deeper surface, and there is the pterygoid process of the parotid gland. Extending downward is another process, which is carotid process. We see here the external carotid artery entering into the substance of the gland. Extending along this artery is the carotid process of the gland. The capsule of the gland has two coverings. So the inner covering is formed by the connective tissue of the gland itself, whereas the outer covering of the gland is formed by dense fibrous capsule. This layer is derived by investing layer of deep cervical fascia. The deep cervical fascia, which is extending upward, reach to the inferior border of the parotid gland. It splits to enclose the gland. Here it splits into a superficial layer and a deep layer, which run on the respective surface of the gland. So here the diagram shows the green color is indicating the fascia. We see the deep cervical fascia coming to the base of the mandible, splitting into a superficial and deep layer to enclose the gland within. Superiorly, the superficial layer of the deep cervical fascia, investing layer of deep cervical fascia, will be attached to zygomatic arch, whereas the deep layer of investing layer of deep cervical fascia will be attached to the temporal bone. So here we see the tympanic plate of the temporal bone. Thus, a portion of fascia will also extend to the styloid process posteriorly and to the angle of mandible. So this process will be called as the stylomandibular ligament. So this is the styloid process in relation with the parotid gland, and this is the mandible. So the fascia will form a stylomandibular ligament. This stylomandibular ligament will separate the parotid gland from the submandibular gland. Now to discuss the relations of the gland. The gland is superficially related to skin, superficial fascia, and the great auricular nerve and the parotid lymph nodes. These structures lie lateral to the nerve. As we dissect for the parotid region, when the skin is incised, we will see the great auricular nerve and the parotid lymph nodes. Then we'll get onto the superficial fascia covering the gland. The superior relations of the gland, that is on the upper part of the gland, that is towards the base of the gland, are the external auditory meatus, the temporomandibular joint. There is glenoid process of the gland which is extending upwards from its superior surface, or also called the base of the gland. The next surface is the anteromedial surface, shown here with this arrow. The anteromedial surface will be related to the stylomandibular ligament running from the styloid process to the mandible, and is a thickening of the investing layer of deep cervical fascia. The other structures are the medial pterygoid muscle, which is attached to the deep surface of the ramus of mandible. The masseter muscle, which is attached to the superficial surface or the lateral surface of the ramus of mandible. Then the free posterior border of the ramus of the mandible. The terminal branches of the facial nerve exit from the parotid gland onto the face along the anteromedial surface. And there is also the temporomandibular joint in the upper part. The relations of the posteromedial surface are the carotid sheath. The carotid sheath is also a extension of the deep cervical fascia. The sheath encloses, as you can see in the diagram, the internal carotid artery, or in the lower part, the common carotid artery, the internal jugular vein, the vagus nerve. There is the bony process called the styloid process. There are muscles and ligaments attached to it. Together, they are called as styloid apparatus. The muscles attached to styloid process are the stylohyoid, styloglossus, the facial nerve can be seen entering from the posteromedial surface into the substance of the gland. Attached to the mastoid process, we see two muscles. On the deeper part is the posterior belly of digastric muscle, whereas superficially there is this muscle of the neck, sternocleidomastoid. So these structures will together form the relation to the posteromedial surface of the gland. The parotid bed are the structures which will be seen when we remove the parotid gland from its position. So these structures will be in immediate deep relation with the parotid gland, and they include both the anteromedial as well as the posteromedial relations of the gland. To enumerate, we can see here the ramus of the mandible along with the two muscles attached to it, that is the medial pterygoid on deep surface and the masseter on the superficial surface. We see here the styloid apparatus with the muscles arising from it, the styloglossus, the stylopharyngeus to the pharynx, styloglossus to the tongue, and the stylohyoid to the hyoid bone, along with the stylomandibular ligament. So this is the styloid process. We see the facial nerve exiting here from the stylomastoid foramen, which is between the styloid process and the mastoid process, and entering into the posteromedial surface into the substance of the gland to divide into its terminal branches, which will exit from the anteromedial surface. We see the muscles attached to the mastoid process. This muscle, which is seen here, is the sternocleidomastoid. The other structures which are seen here are the vagus nerve along with the internal carotid artery, internal jugular vein. The glossopharyngeal nerve or the ninth cranial nerve is seen here in relation to the internal jugular vein. Between the two vessels, the internal jugular vein here and the internal carotid artery, runs this hypoglossal nerve. The nerve which is running posteriorly from the two vessels is here the accessory nerve or the 11th cranial nerve. So these are the structures which are forming the parotid bed. The structures which are entering into the substance of the gland are the auriculotemporal nerve, the external carotid artery, the retromandibular vein, and the facial nerve. So these structures are within the substance of the parotid gland. There are also few lymph nodes which are scattered into the substance of the gland. So in the substance of the gland, from deep to superficial, here in the diagram we can see the auriculotemporal nerve, external carotid artery with its two terminal branches. One which runs deep is the maxillary artery. The one which runs superficially to the superior border of the gland onto the face is the superficial temporal artery. We see the retromandibular vein. The vein, when it is formed, divides into its two divisions. So we see the anterior and posterior division of the retromandibular vein here. Dividing the gland into a superficial and deep lobe is here the facial nerve which runs across the gland from its posteromedial to the anteromedial surface. The secretions of the parotid gland are conducted from the gland to the oral cavity via a duct, that is the parotid duct, also labeled as Stenson's duct. It is 2 inches long. It emerged from the facial process of the gland. We can see here in the diagram the facial process of the gland and the parotid duct. As it passes over the muscles of face, it runs across the masseter muscle, which is the masticatory muscle. It runs a finger breadth below the zygomatic arch. Here in the diagram, we can see the zygomatic arch of the bone, which is between the zygomatic bone here and the maxillary bone here. Here, the duct is accompanied by transverse facial vessels. We can see the transversely running facial vessels. Upper zygomatic branch of the facial nerve running across the zygomatic part of zygomatic bone of the face. And then there is lower zygomatic branch of the facial nerve, which is on the lower side. As the duct runs forward, it turns along the anterior border of the masseter muscle. Here, it pierces the buccal pad of fat, that is the pad of fat which is in the cheeks. Then it pierces the buccopharyngeal fascia between the buccinator muscle and the pharyngeal muscles. Then it pierces through the buccinator muscle and then the buccal mucosa of the oral cavity. Then it opens into the vestibule of mouth through a small opening which is seen as a papilla opposite the second molar teeth. So here we can see a small papilla which is opposite the second molar teeth, and that is the opening of the parotid gland. So here we see how the gland turns around, or we can go to the previous diagram. The gland runs over the masseter and turns here at the anterior border of the masseter. This is the anterior border of masseter. Here it dips and it will pierce through these 4 structures to enter into the oral cavity to open at the papilla against the upper second molar teeth on either side. The oblique passage of the duct in the buccinator muscle acts like a wall mechanism. This wall prevents inflammation or opening of the lung through the oral cavity, and that will be prevented especially during the action of blowing when the cheeks are full blown like this. So the duct can be rolled over the clenched muscle. So when we press the teeth on each other, that is the action of masseter. In this position, we have to roll our fingers over the masseter. We can feel the duct. The duct is represented by this line which runs from the external acoustic meatus. In front of that, there is this fold of the auricle that is called tragus, to the ala midway between the ala of the nose, that is the fold of the nose here, and the upper lip or the angle of the lip. In between these two, between ala of nose and the angle of mouth. So midway between here to the tragus, we have to take middle 1/3 of this line. This line will act as a surface marking for the parotid duct. This surface marking will help us to approach the parotid duct surgically. It will also help us to know the location of the parotid duct when we are examining the patient. Now we discuss the blood supply of the gland. The arterial supply of the gland is from the external carotid artery and its terminal branches. Its terminal branches are one is superficial temporal artery and the other is the maxillary artery. So in this diagram, this is the external carotid artery dividing into superficial temporal and the maxillary. The venous drainage of the gland is into the retromandibular vein. Here we can see the retromandibular vein. Both the arteries, the terminal branches of the external carotid artery as well as the formation of retromandibular vein are within the substance of the gland, which we have seen previously in this diagram. So here we see the terminal branches of the external carotid and the retromandibular vein with its anterior and posterior division. So this is about the blood supply and the venous drainage of the gland. The lymphatic drainage of the gland is into the parotid group of lymph nodes, which are pre-auricular in position or in front of the auricle. The other drainage is into the deep group of cervical lymph nodes. You can see the deep group of cervical lymph nodes in this diagram here. This is the sternocleidomastoid muscle. Deep to it, we can see the deep cervical lymph nodes. The gland receives its nerve supply. It has both sensory and autonomic nerve supply. So its sensory nerve supply is received or conducted via the auriculotemporal nerve. The autonomic nerve supply is both sympathetic as well as parasympathetic. The sympathetic innervation of the gland is through plexus, the sympathetic nerve plexus, which is around the carotid artery. These sympathetic nerve fibers are originating from the ganglion at the level of first thoracic vertebra, that is T1. The fibers are then carried to the superior cervical ganglion. From here, they form a plexus of sympathetic nerves around the external carotid artery. These plexus supply the autonomic nerve supply to the gland. The parasympathetic innervation of the gland is via a peripheral parasympathetic ganglion, which is present in the retromandibular fossa or infratemporal fossa. The name of the parasympathetic ganglion is otic ganglion, which is present physically in relation to the mandibular division of the trigeminal nerve. Through the otic ganglion, the parasympathetic fibers are from the 9th cranial nerve. Then they run into the tympanic nerve, which forms a tympanic plexus. Then through the lesser petrosal nerve, coming to the otic ganglion. From otic ganglion, again the fibers will run through the auriculotemporal nerve. So auriculotemporal nerve itself is sensory to the gland, but also carries the parasympathetic nerve fibers for the gland, which are supplied through the otic ganglion. So in this diagram, we can see the 9th cranial nerve, which is giving the parasympathetic fibers. These parasympathetic fibers are carried through the auriculotemporal nerve to the parotid gland. So we see the path of the parasympathetic nerve supply of the gland. Now we discuss the clinical anatomy of the gland. The parotid duct is superficially placed. Because of this location of the duct, it is prone to damage in facial injury, as well as other surgical procedures which are conducted on the face. The gland is also affected by carcinoma or neoplasm. The malignant growth in the gland is very invasive and it quickly involves the facial nerve, and it will be most of the times reported with the first symptoms in the form of facial palsy. The gland is often inflamed. The inflammation of the gland will result in a painful swelling. The swelling which is present in the parotid gland is very painful because of the tight covering of the fascia which we have discussed in the first part of the class. This tight capsule encloses the gland and any swelling will have a very excruciating pain. The swollen glenoid process will exaggerate the pain during the process of chewing because of its location in the close vicinity with the temporomandibular joint, which will function during the process of chewing the food. The next disorder which is related to the gland is Frey's syndrome. This disorder is characterized by recurrent episodes of localized facial flushing and sweating in the area over the parotid gland. This sweating is mostly in response to the gustatory stimuli. That is, when the person is eating food, there will be sweating over the region of parotid gland. It is characterized by the recurrent episodes of localized facial flushing. The sweating will be seen over the parotid gland in response to the gustatory stimuli. That is, when the gland is supposed to secrete the saliva in response to food in the oral cavity, there will be swelling over the skin of gland. The pathology is because of aberrant nerve regeneration, which is between the auriculotemporal nerve and the greater auricular nerve, such that the parasympathetic fibers will migrate into the cutaneous sympathetic nerves that supply the sweat glands, which are present in the skin overlying the parotid gland. So this is about the parotid gland. When the question is asked about clinical anatomy, you have to explain about the nerve supply of the gland and how it results into Frey's syndrome. That should be explained. So if you have any query, you can ask. Thank you, students, for your kind attention.